Good morning, it's Dionne Mack. I'll be covering logistics and education. For this section, I will be joined by Ms. Emma Swartz, the president of the MCA Foundation, as well as Dr. Nicole Brennan from the Battelle Memorial Institute. I want to begin with just a brief overview of our logistics section and the work that they have been doing in terms of ensuring that we have proper supplies within our community. Next slide, please. Thank you. As you heard Chief Battelle speak about earlier in the presentation, one of the things that we have been focusing on is ensuring that we have appropriate PPE, other resources and supplies to ensure that we can continue to address the needs of all of our stakeholders throughout the city. Next slide, please. So for the EOC, one of the things that they've been focusing on in partnership with Border Rack is ensuring that we have PPE supplies throughout our community. You heard Nicole Farini talk about social service agencies. You may recall back in March, there was a severe disruption of our PPE supply chain. There was rising demand. We saw panic buying. We saw hoarding happening. And so it was really important for us to make sure that we were keeping track of what we had available within our community, not only for our essential workers, but also looking at how we were shifting our need for these amenities for our essential services throughout. Some of the requests that come in are not only from social services agencies, but from dentist offices, small providers. They can utilize these resources to make sure they can continue to operate and do so safely. Next slide, please. So you heard the chief talk about Border Rack and what a wonderful partner they have been and along with us. He mentioned that they were one of the key partners in helping us to stand up our federal testing line. If you're not familiar with Border Rack, they're a healthcare coalition. It was set up back in the 90s by the Texas Board of Health and actually serves over 40,000 square miles. 2 million people. They are housed at the EOC, and they are primarily focused on trauma and emergency healthcare systems and have a variety of partners that they work with to ensure that we can continue to have the type of responsiveness we need in the area of healthcare provisions. They have over 1 million N95 masks. And one of the things I'll talk about a little bit later in the presentation is the importance of education and the distribution of these working hand in hand. One of the things that the education unit did along with Border Rack is ensure that people knew the types of supplies they should be using to help us to be able to extend our supplies on hand. Another thing that was important was for people to understand their burn rate for these supplies so we wouldn't be in a situation where we're running out of the supplies. Next slide, please. So this is a combination of EOC and Border Rack's distribution. As you can see, there's quite a few items that have been distributed. Later in the presentation, Sam Rodriguez will be telling you a little bit about the need for storage. As you can see, we will be dealing with this pandemic for quite some time. Our PPE are no longer just focused on healthcare providers. And so making sure as we're beginning to reactivate our city and our city facilities, as Colonel Weston will talk about, we want to ensure that we have the supplies that are needed to be able to continue and to keep each other safe. Next slide, please. I'm going to hand it over to Ms. Emma Swartz, who will tell you a bit about our logistics and education partnership.
Good morning. Can you hear me?
Yes, ma'am.
Great. Thank you. Good morning, Mr. Mayor, City Council, and city staff. My name is Emma Swartz. I'm president of the MCA Foundation, and our mission at the MCA is to enhance our region's life sciences ecosystem to become globally competitive. I want to begin my statement this morning by sharing an excerpt from a keynote speech that I gave at the UT Houston School of Public Health hooding ceremony in 2018, which embodies what the COVID-19 Enhanced Regional Public Health Partnership is all about. The concepts of convergence, innovation, and implementation are not easy to achieve, but when used collectively, they can transform our world to help solve some of the greatest public health challenges and paradoxes of our time. Today, this challenge is COVID-19. As public health professionals, we have a better chance to achieve our goals by focusing on the convergence of multiple priorities, from what we traditionally think of as public health, to the environment, to public infrastructure, to preventative care, to food security, to mental health, to homelessness, to affordable health care, and to biomedical innovation. Our world has gotten so complex due to technology and globalization that working in our silos is no longer an option. Convening multidisciplinary teams is necessary to develop the innovative solutions that are required for advancement and impact in public health. Although the issues facing public health have not changed substantially over time, pollution continues to rise, people are still hungry, and disease outbreaks continue to have decimating roles around the globe. But we find ourselves in the midst of an intense social and public health transformation, and that is why innovation is in public health matters. And innovation happens most when we step outside of our comfort zones by opening our minds to discovery, by convening people and ideas. So how do we capture the value made possible from convening, which leads to innovation? Through implementation, through taking action and doing. But believe it or not, implementation is difficult, and this is why our global public health perplexities persist. Research practice gaps often exist. Funding and talent may not be readily available to start something new. Change management is incredibly difficult, all presenting implementation challenges. Yet implementation is a choice that we must all make. So that is what the COVID-19 Enhanced Regional Public Health Partnership is all about. It's about making a choice to converge, innovate, and implement. The MCA Foundation worked with the City of El Paso, the Paso del Norte Health Foundation, UT Houston School of Public Health, and a coalition comprised of over 36 businesses and private funders to create this public-private partnership to help our community respond to the pandemic through convergence. This public-private partnership is guided by the expertise of the Battelle Memorial Institute, one of the most innovative research and science organizations in the world. And we have worked tirelessly since March to implement a series of actions that would improve our community's response to the pandemic. As you've heard many times earlier today, we have a highly vulnerable population in El Paso and Juarez, and our enhanced response must convene the right people to take innovative actions to best serve our community. The partnership has the following goals: to provide critical resources to protect the public and our essential workers on the front lines, work with the city and regional officials to coordinate care and enhance communication, tackle this pandemic as a region, creating a coordinated and seamless response between El Paso, Ciudad Juarez, and Las Cruces. To implement these goals, we have focused on the following. To begin with, we have a Ppe Committee that we organize weekly over Zoom with over 60 people invited and regularly over 30 to 40 people attending. We discuss the EOC, border rack, and PPE supply and demand, non-medical community PPE needs, PPE training, and communication with employers on reopening needs. An MCA board director, Holly Trubovich, has voluntarily led a needs assessment and purchasing effort to supplement the work of border rack, requiring over 30 hours of her work each week. She has obtained email data from over 80 different industries, including home health, retail, construction, etc., and sent out over 1,600 emails with a link to the PPE order form that she created. And she's coordinating these efforts with the border rack. Secondly, she found and validated vendors with an emphasis on local vendors and determined a group purchasing strategy and obtained quotes, including item price, packaging, minimum order quantity, availability, etc. She assembled a PPE source list that is frequently updated and available on the Paso del Norte Health Foundation's website, the COVID-19 Hub. She is working on still obtaining all the N95 masks needed, but she has procured over 6,000 of those to date. Similar to the PPE committee, we launched a private sector testing committee, which again is a weekly meeting organized with over 70 people invited and over 40 people attending to develop a collaborative plan with the city and county for reopening safely. This plan must include, among other things, COVID-19 testing. The MCA and UT Houston School of Public Health have conducted a focus group of employers in El Paso to determine their strategies for COVID-19 testing upon reopening and thereafter. The MCA conducted market research on regional testing capacity relative to the regional demand for testing required for return to work following COVID-19. The MCA requested information from various different laboratories and interviewed several of them, and is in the process of developing a white paper for private sector testing. Another initiative is through Bio Paso Juarez, our binational medical device cluster group supporting the PPE efforts. It quickly developed and disseminated a survey to assess the impact of COVID-19 on the medical device manufacturers in the region and created a report summarizing these results that was distributed to the community and elected officials. They created an online hub for manufacturing community to share resources and developed a COVID-19 response task force that has met twice weekly since April 3rd. They've developed and disseminated a follow-up survey to determine the types and levels of production of PPE in this region and available for local use. They've created multiple resources for medical device manufacturers in Juarez to anticipate and respond to Mexico and state federal audits and inspections in order to continue operations and productions. We've coordinated a coalition with our coalition webinars on our PPE work and soon on supply chain and sourcing. We're also leading efforts to provide and help Ciudad Juarez medical providers access essential PPE that they need. In addition, we are working with the Tech Labs and El Paso County Medical Society to 3D print over 250 face shields for distribution to El Paso physicians and community-based clinics. We expanded access to the Mayo Clinic COVID-19 convalescent protocol opportunities by informing our regional healthcare institutions about this opportunity and how to become a registered site. We introduced local virtual care providers, including electronic caregiver and VemiDoc, to our region's healthcare systems and outpatient clinics that will enhance patient safety by providing medical care virtually, remotely, and in the patient's home. We convened a COVID-19 clinical trials task force to drive innovative COVID-19 vaccine device and diagnostic trials here in our region. And lastly, but not least, certainly, we are leading several efforts to assist Ciudad Juarez's response to COVID-19. MCA expanded its contract with Battelle to include Juarez, and Battelle is doing data modeling for Juarez. It is getting the permissions needed to import contaminated N95 masks from Juarez into El Paso for decontamination. They are working on COVID-19 testing research, sourcing, and practices, including contact tracing best practices. We are sharing best practices for employers and industries for workplace modification for the manufacturing industry in Juarez in partnership with the U.S. Consulate. And we are working on medical practice sharing through the COVID-19 El Paso Juarez Medical Community Exchange. This is a webinar series that we launched to discuss predetermined topics with robust Q&A opportunities. The speakers and participants are Spanish-speaking El Paso and Juarez medical professionals who want to share ideas about how to combat this virus. We are also creating a web-based Spanish language forum to ask questions and get feedback between El Paso and Juarez medical peers. As you can see, our public-private partnership is working hard to convene the great talent of our region under a common work plan to develop innovative solutions to this complex pandemic that are making an important difference to both the El Paso and Juarez community. In closing, I want to thank our partners and coalition members for their work and support, and I must acknowledge our generous and thoughtful donors without whom this partnership would not be possible, including the Paso del Norte Health Foundation, the Hunt Family Foundation, the Foster Family Foundation, El Paso Electric, the Public Service Board, One Gas Foundation, West Star, TransTelco, and Larry Wolschlager. And finally, I want to thank the city staff from whom you have heard so much great work and effort and dedication today. It has been a great pleasure to work with them on all of this. I also want to thank the Mayor and City Council for their leadership and guidance during this difficult time. Thank you.
Okay, I want to introduce Dr. Nicole Brennan, will take us through some of the work that Patel has been doing with us.
Thank you, Mr. Mayor, City Council members, and Dionne for your introduction. I think Dr. Ocaranza did a tremendous job earlier describing really the science behind this epidemic and this disease. And Battelle considers our role to support the dissemination of that science and the science behind public health preparedness. So the staff that are working on this project along with me have state, local, and national experience with pandemic response, including H1N1 and Ebola. And we've been working to really help connect the dots, if you will. We've worked at the state level during pandemics. We understand the trials and tribulations of what it means to really respond to a disease this complex and what it takes to really engage stakeholders while also meeting all the various needs of supplying PPE and talking with, your congressional members, as well as providing testing or later on vaccination. So we're trying to help bridge that communication between the stakeholders and the EOC as part of our EOC support. Also trying to make sure that the EOC is aware of some of the communications with the stakeholders are also trying to pass their way. As Emma mentioned, we're also supporting testing and tracing, some of that being tracing that businesses could potentially do for themselves to help let employees know if they have come in contact with another individual who tested positive for COVID. What does that mean? How can the businesses themselves be supportive of public health by doing that level of tracing and notification amongst their own employees? Testing, looking at ways to implement point of care plus the PCR testing, and how and where those might be most appropriate if you have limited resources, as we've been experiencing throughout this response. For surge capacity, we have been working with the hospitals pretty closely to look at various models. As I'm sure you're all aware, there are hundreds of models out there right now related to this pandemic. And one of the challenges with those models are when you go to validate them. And the best way to validate them would be to, let's say, take New York, enter in information that you had, let's say day one, and then see if your model projected out what actually happened. So there just hasn't been a ton of time to actually validate a lot of these models. And so we are trying to use them as tools, not as rules, if you will, that they're just trying to guide us in our preparation and make decisions. So we have worked with the Fort Bliss staff to look at their models and compare those with the data that the hospitals have to make those decisions on, should we be spending our energy to open up a surge hospital, or should we be doing something else? Part of that might be just looking one day at your census in a hospital and saying, okay, if we opened up a surge hospital, how many people who are currently in our hospital would we be able to send there? And that would tell you really if it was going to open up beds for you. That has been one of the primary focuses for me over the past couple of weeks, and trying to help guide that understanding. And then now considering as we go into the summer, and then as Dr. Ocaranza mentioned, if there's a second wave, what does it mean if we have COVID on top of flu cases? What does that mean for the hospital capacity at that point? For PPE, we have been, as Emma mentioned, working a lot with Juarez around what kind of PPE they have, what kind they don't have, how can we assist them with identifying additional PPE, how can we assist Juarez with identifying testing options. So there are a lot of people out there who are trying to sell tests to cities and countries that have been underserved. And one of the things that my staff has been doing is really researching some of those companies, even having conversations with third-party distributors to try and assess whether or not this is a legitimate test, or if this seems like there are too many red flags to move forward. And I really think it's very apt that this is falling under the logistics and education slide deck, because that really is what we have been trying to do, is get out that education piece and provide any presentations that we can give to the general public or to the partners that help to put this into the language that they would most respond to. And for example, as part of our outreach, we've been working with the Medical Society to sort of revamp their newsletter so that it spoke more directly to the clinicians. What were they asking for? What could we provide them? And we had gotten pretty good feedback on that. Next slide. As I'm sure most of you are aware, there is a Battelle decontamination unit in El Paso. And if you can go to the next slide, that would be great. So the point of the decontamination unit has always been to fill the stopgap between a lack of PPE and trying to make sure that our health professionals were covered in their protection. And so we designed these systems a couple of years ago, actually, when the FDA was preparing for pandemic response, and worked with them to identify ways that we could clean N95s, and did a lot of research several years ago on that. And when this pandemic came back around, we engaged with the FDA to say, you know, we did this research previously, would you like us to ramp that up and to distribute out these decontamination systems? So we were contracted to deploy 60 of those, one that is in El Paso, and make sure that healthcare professionals are well aware that they are there and that they can be used in times when they have a lower supply of N95s than they might feel confident that they could meet the need of their patients. So some of you may have heard or read stories recently that question the science of the decontamination units. And what I can say is Battelle very much prides ourselves in being an independent science and research organization. We worked very hard to develop the science and submit the science behind the decontamination units, and we have the data to support them. And we would certainly never put something out in the field that we didn't feel had that level of backup, and also didn't have the reviews it needed from the FDA. So if there are any additional questions around those systems, I am more than happy to answer that. Next slide.
Okay.
Yeah.
Thank you, Nicole.
Thank you, Dionne. Yep.
So, Council, we've done presentations for you before talking about the Education Task Force, but I think that you can see through the various presentations, it is very much about the entire organization and all of our community partners working together to make sure that we're doing the outreach and getting critical, reliable information out there to people in the way that they need it. Our Communications Task Force, that's led by Ms. Laura Cruz Acosta, has been doing an incredible job with social media. You've heard from our community partners in terms of the work that they're doing, from Nicole Farini in terms of their engagement with our retirees, as well as our neighborhood coalitions. We continue to have our Education Task Force for us be boots on the ground and a complementary piece to our compliance folks that you'll be hearing from a little bit later, to ensure that we're getting the information out there to providers as we're changing our orders and helping them to understand what's expected, but also using the opportunity to provide education on how to best use the limited resources we have with PPEs and others, as I've discussed previously. Next slide, please. And so you've seen some of this information before, and as you can see, we're continuing to shift our focus and efforts based on what we're seeing happening within the community. You heard Chief D'Agostino talk about cluster management and the work that we're doing around nursing homes. That was phase 2 of the work that the teams focused on. We started to hear a lot from the community in terms of grocery stores and other small markets as we were starting to implement mask requirements. And so the team shifted to make sure that we were out there having those conversations with grocery stores and small supermarkets. They visited over 677 of those. within a roughly 2 or 3 week period. And now they're still continuing to focus on restaurants. As the questions regarding our new orders were asked earlier on, it's going to be important for us to make sure that we're actually out there having the conversation with those who are going to be opening up so that they understand what's needed, what's required. And it is very much a partnership in terms of how we do that. You've heard Emma talk about the partnerships and the work that they have been doing around helping private entities and businesses stand back up. They've been working with the Better Business Bureau to make sure that information is available to those businesses in terms of PPE, how do they get cleaning supplies, really making sure that as much as we can do to help our community understand what the next steps are, but also to make sure that they can be safe in terms of how they execute those as we continue to see our numbers climb. Next slide, please. And just again, you've seen this information before, but just as a reminder that not only are we going out having conversations regarding, the virus and information that's going to be important, but we're also asking nursing homes and others as we're doing this cluster management to share with us their improvement plan. And so we have an idea of how they're planning to address this issue and making sure they have those in writing for everybody within their facilities. And they're continuing to gather those plans from our cluster group. Next slide, please. You continue to see in our EOC daily sit rep the improvements and the increases that we have to these numbers. And we will continue to shift to ensure that our resources that we have with the Education Task Force works very closely with a variety of partners to make sure that we're focusing our effort and energy where it can be best deployed throughout the city. I am so grateful to all the teams that are working on the task force. As you saw in the previous slide, we have the Department of Health, we have aquatics, we have museums, we have parks, we have libraries, our fire department have really stepped up to make sure that we have the resources to get out there every day to the community in the way that they need to have this information deployed. So I just want to thank all the team members and all of our partners that we continue to work with to ensure that we can do the best we can for our community. And with that, I'm going to hand it over to Ms. Ellen Smythe, who will talk about compliance and service delivery. Thank you.
Good afternoon, Ellen Smythe, Environmental